Welcome to STMU Spotlight, where we explore the people shaping the future of science, technology, and education. I'm your host, Dr. Paul Uhlig, Professor and Chair of Mathematics. Today, I'm excited to welcome Paige Severson from our nursing program to share about her journey at St. Mary's and beyond. Paige, welcome.
Hi, thank you so much for having me.
It's wonderful to have you with us today. Let's start at the beginning about what drew you to nursing. Your journey is very special. Can you say a little bit about how your experience with healthcare shaped your decision to pursue nursing?
Sure. Before nursing, I was the patient myself. I have a lot of health conditions like endometriosis, celiac disease. And when I was a senior in high school, I took a course to become a CNA. I just hit the 4-year mark last week of being a CNA. And I think working at the nursing home, seeing how much I've helped those people, how grateful they are, I think that just made me want to keep going even further into nursing.
That's wonderful. So you have support systems, whether mentorship or community. Tell a little bit how those have supported you so far.
Well, I think I have mentorship through my job. The nurses at my job, they're more than happy to share with me their experiences, and they teach me skills that I want to know. I remember at one point, one of the nurses at my job, he was like, "Hey, do you want to watch me insert this catheter?" And I was like, "Absolutely."
Oh, it's wonderful. Lived experience.
Yes.
So St. Mary's emphasizes a holistic approach to care. Say what that means to you.
I think that really resonates with me because I think sometimes we'll be caught up in the moment and we forget they're not just a number. The patient's not just another number, they're also another human. So we have to remember to keep that human interaction. It really emphasizes the mind, body, and spirit. And I think that's important, especially nowadays.
So what's it like being part of a small, close-knit cohort?
I love it. I feel like it makes my classmates and I really close. I think we have a special bond. We're very tight-knit, and because it's so small, we get to collaborate better. And I think we uplift each other, we help each other out. We even initiate our own study sessions without the teachers telling us to. We're just like, "Hey guys, let's do well on this test. Let's get together and study."
How do you imagine sharing these lessons from your early experiences in a nursing program with future cohorts?
I think I want every cohort to have a unique experience, but what I want us to all have in common is that I want them to learn a lot, take a lot out of it, and build these friendships and connections that'll last you a lifetime.
So you're learning in the Blank Shepherd Innovation Center with all of those wonderful simulation labs and advanced technologies. Say a little bit about that experience.
I think it's great. I think to have the best learning experience, you have to have the best technology, and that's exactly what we have. I love when new students and their parents come and I get to show them, and the parents are just like, wow. And I always tell my classmates, because they're nervous, I'm like, mess up on the mannequins as many times as you want, because it'll build your confidence, and the more you mess up on the mannequins and learn from your mistakes, the better you'll be when you actually get to encounter a real patient.
Mistakes are the foundation of real learning.
Yes.
And we just need to get in there and make those mistakes.
Absolutely.
So nursing requires quick thinking and adaptability. Are you feeling yourself on the journey to quick thinking and adaptability as a nurse?
Oh, yeah. So through our simulations, like the fall simulation, for example, you have to think quick on your feet, not for your own personal interest, but what is the quickest yet safest thing to do that causes the least amount of harm. And I think the faculty prepares us so well for that, because for the simulations, they kind of throw us out there, and all of a sudden you have to think back to what you learned in class really quickly to have the best choice possible.
It's not like a math class where there's rules that tell you have to do this or you do that.
Exactly.
You really have to really have to be present to the moment.
Every situation is unique, and I think that's what I love about healthcare because I think I get like, let's say if I was just working in an office, I would get really bored with the same routine, but I love healthcare because you never know what to expect.
I believe it. I believe it. You mentioned an interest in working with women and children. What excites you about that path?
I think it's so exciting. Well, specifically labor and delivery, I think it's exciting to bring new people into the world.
Oh, that's wonderful. So, what are your goals? Where do you see yourself after completing this program?
I would like to apply to a nursing residency program, specifically in the area that I'd like to work in, labor and delivery, peds, something with women and children. I'd like to be in a nursing residency program so I can be a pro in that area and then eventually work for whichever hospital I do the residency at.
What advice would you give somebody who's thinking about nursing at St. Mary's?
I would say work hard and don't doubt yourself.
What should they know before they start?
Get a good pair of white tennis shoes.
Comfortable shoes.
Yes.
Thank you, Paige.
Thank you.
On behalf of SET Spotlight, thank you to our very special guest, Paige Severson. We invite everyone to join us again on the next episode as we continue to highlight the people advancing science, engineering, and technology at St. Mary's University. Until then, elevate your excellence, shape excellent tomorrows.